pulsatility index is a measure of resistance to flow in a blood vessel. And high pulsatility index means high resistance, while low pulsatility index means low resistance. And in a normal fetus, pulsatility index is low in almost all blood vessels except middle cerebral artery. In middle cerebral artery, pulsatility index is relatively higher. It means that in middle cerebral artery, resistance to flow is relatively high. So before even measurement of spectrum, first of all, I visually evaluate the spectrum. For example, it's spectrum from umbilical artery in a normal fetus. So I look at the spectral flow and I see that it's quite fluffy. It's high with high diastole. High diastole indicate low resistance state, and low resistance means low pulsatility index. Then the same rule can be applied to all vessels. For example, it's ductus venosus, and again I visually assess the flow and I look at the diastole. Diastole is high, it means that low resistance and low pulsatility index. But in normal middle cerebral artery, and diastolic flow and overall diastolic flow cannot be high, because in normal state middle cerebral artery a little bit constricted, and cerebral-placental ratio. It's the ratio of middle cerebral artery PI to umbilical artery PI. And as I already described, middle cerebral artery, pulsatility index is relatively higher than in umbilical artery. Therefore, ratio is higher. While in hypoxia, PI in middle cerebral artery decrease, and PI is umbilical artery increase, and therefore ratio decrease. We will have a relatively lower ratio. So in a state of hypoxia, we will see that again I visually assess the spectrum. I see that diastole high. So before measurement, I can conclude that it's not normal. Why it's not normal? Because in middle cerebral artery, if I will have high diastole, it means that my vessel dilated, and dilated vessel, it means that it's state of brain sparing effect. So in this case, all vessels in fetal body will constricted in order to redistribute blood to the fetus brain, and it will ultimately lead to brain edema and death. So I look at this spectrum again, and I see that high diastole mean low resistance and low PI. Therefore, in middle cerebral artery, low PI is relatively negative sign. Again, fluffy flow in the middle cerebral artery is not good. If you look at this image, There are 4 different cases. The first cases is a normal fetus, umbilical artery and middle cerebral artery. So the first is a normal, and the last is a case of severe intrauterine growth restriction. And from normal to severe case, I will see that in umbilical cord, my diastolic flow consequently decrease and finally become negative. It means that it become a reverse flow. While in middle cerebral artery, I see opposite. I see that from normal to severe state of intrauterine growth restriction, there are increased diastole. So in this case, diastole significantly increase. It means that my PI, pulsatility index, decrease in middle cerebral artery. We also use middle cerebral artery Doppler assessment to evaluate for fetal anemia. So in fetal anemia, I will see high peak systolic velocity. High peak systolic velocity is a good indicator of fetal anemia. So, and the peak systolic velocity increase because in fetal anemia, there are increased cardiac output.